Hi, I'm Dr. Jay Caylor with Pain Specialists of America. Today we're going to be talking about different types of injections that we can perform on the lumbar spine. In the lumbar spine, we have a number of different anatomical targets or pain generators that we can treat with single injections. Today we're going to talk about epidurals. Now, oftentimes we get patients that come to us and say they've had a shot before in their spine, but they're not sure what that injection was. Before you have another injection, or just so you can have a little bit more information, we're going to talk about the different types of epidurals. The first and most common type of epidural that everyone kind of continues to mix up with a labor epidural or a pregnancy epidural is an interlaminar epidural. What this means is that the needle is going between the bones of the spine in a midline approach and giving things like steroid, preservative-free saline, preservative-free numbing medicine like lidocaine into the epidural space from the front. The spinal cord and nerves take up this steroid and it decreases inflammation to be able to help pain relief. This is a pretty common and safe injection, but as with anything, there's small risks like bleeding, infection, irritation to the nerves. Additionally, each patient should be evaluated to see if they're a candidate for an interlaminar epidural, because things like spinal stenosis may not be the best way to, the interlaminar approach may not be the best way for those patients. The other type of epidural we have is something called a transforaminal epidural. With this, we go right at the nerve root that we were talking about before, and we introduce a very small needle next to the nerve root and push medicine through a tight space into the epidural space where the spinal canal is. Now, the difference between this and an interlaminar approach is we know that from fluid dynamics, fluid follows the path of least resistance. So if you're doing a midline approach epidural and you have a really tight space in the foramen, that medicine may not reach the nerve root because that nerve is pinched where it's coming out. Instead, the medicine's going to go to more open areas. And that's one reason why an interlaminar epidural fails. However, a transforaminal approach epidural, where we're going right at the foramen, allows us to push medicine past any obstruction and into the epidural space, thus delivering medicine to where it's needed, right at the nerve root where the nerve is pinched. This injection can be a little bit more more uncomfortable, however, and that's because that space is really tight and we're pushing that medicine into the space. With both of these type of injections, it's important to note that the nerves take up the medicine and help to decrease inflammation, both at the origin of where the nerve is exiting the foramen, as well as in the midline. Over time, we expect that these steroids will work in 10 to 14 days to reach optimum relief to be able to see if this is an appropriate therapy for you. As with anything, there's small risks like bleeding, infection, irritation to the nerves, and those are the things that we're watching for afterwards. Thanks for listening to this video, and I'll see you guys next time.